Okay, so hi everyone, my name is Reema Taneja. Welcome to the key areas to check before adding telepharmacy to your business model. I am a healthcare innovation attorney at Nixon Gwilt Law, which you may know is a firm that serves healthcare innovators who are seeking strategic, legal, regulatory, and business guidance to help them achieve their goals of improving lives of people around the world. I've been with Nixon Gwilt for almost 2 years now, and I work with clients in the digital health space. So this includes telepharmacy, telehealth in general, virtual care management, and other related industries. Before we get going on the substance, I will just quickly share with you this important notice. It basically says that this webinar is informational only. There is no establishment of an attorney-client privilege through this webinar, and further, nothing in this presentation should be construed as a guarantee of reimbursement. All right, so here is our agenda for our webinar today. At a high level, as you all have seen, telehealth has exploded in recent years due to the COVID-19 public health emergency, although it has been around for a number of years. Similarly, telepharmacy is currently growing at a rapid pace. However, many states still have not yet adopted this practice or are not aligned with each other regarding the types of telepharmacy services that should be permissible. So during this session, we will move through the timeline of how telepharmacy first began, where the industry is now, and how much further we have to go. So we'll cover the law, the practice, and the money to help you all understand all of the considerations that are at play when you're thinking about adding telepharmacy to your business model. As we discussed telepharmacy, there are a few key definitions that we should become familiar with. These include telehealth, telepharmacy, teleprescribing or online prescribing, and e-prescribing. These are all related terms, but they do have distinct definitions. Telehealth, for example, is defined as the use of electronic information and telecommunications technologies to support and promote long-distance clinical healthcare, patient and professional health-related education, and public health and health administration. Technologies may include video conferencing, the internet, store and forward, imaging, streaming media, and landline and wireless communications. Next, so for telepharmacy, states do have varying definitions, but most states do follow some form of the National Association of Boards of Pharmacies definition, which refers to telepharmacy as the provision of pharmaceutical care through the use of telecommunications and information technologies to patients at a distance. Teleprescribing or online prescribing is also defined on a state-by-state basis, but is generally defined as prescribing a drug or other treatment through telemedicine. And most states require an established physician-patient relationship before this is allowable. Lastly, the Centers for Medicare and Medicaid Services, or CMS, defines e-prescribing as a prescriber's ability to electronically send an accurate, error-free, and understandable prescription directly to a pharmacy from the point of care. Based on these definitions, you can see that teleprescribing and e-prescribing may sound very similar to telepharmacy, but they are different concepts. And for today's webinar, we will be focusing on the practice of telepharmacy. So just to give you a little bit of background on how telepharmacy began and where we are now, you will see that telepharmacy followed shortly after telehealth was adopted. So we know telehealth came into existence in around the 1960s, and telepharmacy followed in the early 2000s to address the lack of pharmacy access in rural America. So it started during a project called the North Dakota Telepharmacy Project, where the North Dakota State University conducted a study in 2002 to evaluate the safety and efficacy of telepharmacy in the retail and hospital pharmacy settings. So the study had positive results and showed that the error rate related to telepharmacy services was actually below the national average of the error rate presented by providing other forms of traditional pharmacy services. So due to the success of the North Dakota Telepharmacy Project, the Board of Pharmacy in North Dakota permanently implemented telepharmacy regulations in 2003. The US Navy then became the largest user worldwide. As you know, there aren't traditional pharmacy services available out when the US Navy is on their ships. And so they really had a need for the virtual form of pharmacy services. Shortly thereafter, the Washington State and Alaska followed and adopted the practice of telepharmacy. And then the practice slowly began expanding into other central and western states. So you will see that the focus of implementation was on rural communities. And this is due to the lack of pharmacy access in these locations, which are also known as pharmacy deserts. Now we are starting to reach the eastern states and more urban communities. There are around 26 states that have now adopted telepharmacy, according to Telepharm, which is one of the leading companies in this space. And I say around 26 because states are literally issuing regulations on telepharmacy as we speak. So it is ever changing. So here is a map of state adoption of telepharmacy. You can see the green states, which means that some form of telepharmacy is permissible. So as I mentioned earlier, states are differing on what types of telepharmacy services are allowed. There are some states that allow, pretty much generally anything that is a pharmacy service to be provided virtually. Other states narrow it to more specific types of services. And the states in gray are where there are no telepharmacy regulations adopted that permit this practice. Some of them are in the process of issuing regulations, but they haven't approved it just yet. Okay, so on this slide, you will see how telepharmacy is currently being used in practice. Here we have a common use case, which involves a patient, of course, a primary care physician, a telepharmacy, and a telepharmacist. So the way this typically works is the patient visits or televisits her PCP. The PCP then sends an electronic prescription to the telepharmacy. The technician who is at the telepharmacy sends images of the prescription and details to the telepharmacist through telecommunications for review. The telepharmacist then contacts the PCP if she or he identifies any contraindications. If the telepharmacist approves or disapproves dispensing the drug, then they will either dispense the drug accordingly or let the PCP know why they're not approving it. If the drug is approved, the telepharmacist will then coordinate delivery of the prescription with the patient and is available for remote counseling with the patient through real-time audio video as needed. Okay, here are a couple of additional examples of telepharmacy services. I have divided them up into 4 categories to kind of show you what the different buckets are. These are just examples. It's not an exhaustive list, as pharmacists in this space are continuing to come up with various creative ways to implement telepharmacy services. So the first one is related to medication or disease management. This may include drug therapy monitoring, medication therapy management or MTM, and chronic care management or CCM. The second category is remote verification, which includes remote supervision of a pharmacy technician, as we just discussed in the previous use case, prescription verification, and even compounding. The third category is patient counseling. So this is to address medication adherence and other questions patients may have about their medications. And lastly, we have medication review, which includes medication reconciliation, which may occur in the inpatient setting, and new medication counseling, which may also occur in the inpatient setting upon discharge. So next we will talk about reimbursement. So there is a lot of uncertainty regarding coverage for telepharmacy services. There isn't really a standard for payers to directly reimburse for telepharmacy. It is not covered by Medicare currently, for example. There are ways to bill for traditional pharmacy services that are being provided remotely per state law, and this is in part due to the COVID-19 public health emergency, where there have been certain waivers, but there's no established reimbursement for telepharmacy itself. And as you may know, pharmacists are not eligible providers under Part B to bill for general telehealth services, but can sometimes provide services incident to a billing provider. And this kind of ties in with the policy issue of provider status, which we know many pharmacy groups have been working on for years to allow them to practice at the top of their license. So in its current state, there isn't really a reimbursement pathway under federal or state programs for telepharmacy, as well as commercial payers. But because the service is starting to become more integrated into the healthcare system, we might start to see states creating regulations addressing this. So to give you an idea of what telepharmacy reimbursement could eventually look like, I'm going to review what the reimbursement landscape looks like for telehealth currently. So Medicare is reimbursing for telehealth, and we are also in a situation now under the public health emergency where there has been an 1135 waiver to allow for more expansive coverage of telehealth. So an 1135 waiver is essentially allows the Secretary of the Department of Health and Human Services to temporarily waive or modify certain Medicare or Medicaid requirements during a PHE to ensure there is sufficient access to healthcare items and services for beneficiaries, and also make sure that providers who give such services can be reimbursed appropriately. So in order to be reimbursed for telehealth services, they must be included on the list of allowable telehealth codes, which is established annually by Medicare. The reimbursement rate is the same as the comparable in-person visit. And CMS did recently expand the list of eligible providers during the PHE who can bill for telehealth services, which you can see here. So, of course, there's physicians, NPs, PAs, also registered dietitians, physical therapists, and speech language pathologists are eligible providers. You will see that pharmacists are not on this list, similar to the discussion we just had about them not having provider status under Part B, but pharmacists can explore collaborative practice relationships and incident to billing pathways with eligible billing practitioners. Continuing our discussion on reimbursement of telehealth, the Medicaid programs in all 50 states reimburse for some services provided by live audio video. There is a state-by-state determination as to which services are actually reimbursed. And lastly, from the commercial payer perspective, about 43 states currently have laws that relate to commercial coverage of telehealth. Several states have payment parity laws requiring the same reimbursement as for an in-person visit. So this just kind of gives you an idea of eventually what the landscape could look like for telepharmacy as well. But of course, we weren't there at the beginning of telehealth, so it's definitely something that we'll have to look out for. So this slide shows some potential telepharmacy business models. Sometimes we get questions on what a model might look like to actually implement telepharmacy services. So I've included here 4 categories of examples of how you can add telepharmacy to your digital health business model. So you may be in a situation where you are looking to add ways to incorporate traditional pharmacy services. So this would include filling prescriptions, doing medication reviews, or patient counseling. You might also want to integrate a way to address remote consultation sites, which means the prescriptions are prepared at a central pharmacy and then delivered to rural sites. And this may also include patient counseling. The third one is the hospital telepharmacy use case. So this is a situation where you might have a hospital as a customer and you are offering ways for them to streamline prescription processing and verification. There might be automated dispensing machines, which is our fourth category. It's essentially a kiosk that helps with prescription processing and verification. There's usually a nurse or a technician at the hospital who's assisting with this process. And then there's the ability to have consultations with the prescribing practitioner just to ensure that the correct medications are being dispensed and any errors that might occur are being reviewed and caught at the outset. And all of these essentially, most of these include a way to offer patient counseling through live audio video. There are also some other industry trends that are important to note. Some of these do tie into telepharmacy, but also just the ability for pharmacists to get involved with digital health in general. So we've heard about, value-based care being the future for healthcare, and many practitioners have already started to create and implement services that speak to value-based care. Pharmacists definitely have been advocating for this for years. Value-based care represents how healthcare practitioners can really just become more integrated in their patients' care. So telepharmacy can definitely play a role here because it allows pharmacists to improve patient outcomes, reduce costs, and decrease hospitalizations, particularly by facilitating increased access to medication adherence services. There have been many studies that show adherence to medications really can lead to decreased hospitalizations if patients just take their medications on time, especially if they are suffering from multiple chronic conditions. It also, pharmacists can also use telepharmacy to manage multiple medication regimes virtually, and also engage with patients more frequently and efficiently. As we discussed, offering patient consultations is one of the key ways that pharmacists can continue to interact with their patients and discuss any questions they might have with their medications and ensure they are sticking to their medication schedules. Another way pharmacists can get involved in digital health more generally is through virtual care management. So there's medication therapy management, or MTM. There's also remote patient monitoring, which essentially would allow pharmacists to serve as clinical staff and help review patients' data that comes through a medical device. Remote therapeutic monitoring, which is a new service that CMS implemented and actually specifically referenced medication adherence through the use of a device. And then there's chronic care management as well, which kind of ties into everything we're speaking about and helping patient manage multiple chronic conditions. Okay, so now that we've discussed potential business models, of course, there are legal implications that arise when we're talking about how to partner with different practitioners or entities, and especially if you are providing services that will ultimately be billed to a federal healthcare program, so Medicare or Medicaid. The first one to consider is the Anti-Kickback Statute, which you might be familiar with, but this is a criminal law that prohibits the knowing and willful payment of remuneration to induce or reward patient referrals, or the generation of business involving any item or service payable by a federal healthcare program. So although telepharmacy directly is not reimbursed by Medicare or Medicaid, it's still important to keep in mind in case you are offering some of these other virtual care management services that are reimbursable, or in the case in the future, if Medicare starts to reimburse for telepharmacy directly. So essentially this comes into place if you are partnering. So say you are a digital health company, you've created a telepharmacy software, and you are looking to contract with customers, so either physician practices or hospitals and health systems, and you want to offer your software and any associated services to that customer, and accordingly, of course, you would charge a fee for your services. So it is important to review your business model with an attorney to make sure there are no fees that are based on the volume or value of services that are being provided, and there are no kickbacks being exchanged between the parties. There are, of course, safe harbors that exist, and we can, when we evaluate a business model, we definitely want to keep those in mind as well to see if, if there is a risk under AKS, there might be a safe harbor that applies. And importantly, the OIG, which is the Office of Inspector General, issued flexibilities in 2020 to reflect value-based care. So this is definitely something to keep in mind as we were talking about telepharmacy services and really becoming more integrated into patient care. The other important fraud and abuse law to consider is the Physician Self-Referral Law, also known as the Stark Law. So this prohibits a physician from referring a patient to an entity that the physician or the physician's immediate family member has a direct or indirect financial relationship with for certain designated health services that are reimbursable by Medicare or Medicaid, unless an exception applies. So this would arise in a situation if you were partnering with a physician and that you were considering giving them an investment interest in your entity that would result in the physician referring patients to that company or your company. And in that case, there would be an issue of self-referral. So it's definitely important when you are thinking about how to integrate telepharmacy services or any healthcare services that are eventually going to be reimbursable by Medicare to ensure that you are in compliance with these fraud and abuse laws. And we'll talk about state law as well that ties into this discussion. Okay, so it's also important to consider HIPAA and also privacy and security standards that exist, especially because you are using technology and essentially you will be collecting protected health information. So usually what we recommend is using a HIPAA compliant technology, as pharmacies are usually considered covered entities. So if you're partnering with a pharmacy, for example, they will have PHI coming in that your software will help to monitor or keep track of. Similarly, physician practices, usually your customers, if they're healthcare practitioners, will be considered covered entities, and that would essentially make you, if you're the telepharmacy software vendor, for example, a business associate. And HIPAA does apply to both covered entities and business associates. I won't go into the list of who covered entities are, but essentially healthcare providers who are billing electronically, health plans and healthcare clearinghouses. And then business associates are people or entities that are performing certain functions that involve the use or disclosure of protected health information or PHI on behalf of or if they're providing services to a covered entity. So in this case, you will want to make sure you are entering into the appropriate business associate agreements with any covered entities or other vendors that you are contracting with. So as I mentioned, there are also state law considerations to be aware of, as well as the boards of pharmacy. So many states do have their own versions of the Anti-Kickback Statute and the Stark Law, as well as fee splitting laws. So even if you're in compliance with the federal versions of these laws, it's important to also closely analyze and evaluate your business model under relevant relevant state law that addresses similar issues. There may also be additional, additional pharmacist licensing requirements in each state where the patient is located. So if you're a digital health company, this is not as important to your staff members, but if you are contracting with pharmacies or if you are hiring pharmacists in terms of providing virtual care management services, it will be important that those pharmacists are licensed appropriately in each state where the patients they are serving and you are serving are located. There might also be additional pharmacy licensing where services are being provided. So some states do have a separate licensing requirement for telepharmacies. And that does depend on a state-by-state basis. So it's important to make sure you are evaluating those requirements as well. There also might be adoption of telepharmacy via pilot programs or projects. So as we saw with North Dakota, legislation at a state level, and then of course, the administrative code, which is usually regulated by the Board of Pharmacy. And as I mentioned, these laws are changing very rapidly and consistently. So it's important to be aware of the climate that is in the state that you're looking to operate in. Okay. Another thing that I wanted to mention is enforcement. So the Office of Inspector General, as I mentioned before, they are within the Department of Health and Human Services, and they are responsible. They are responsible for looking at fraud, waste, and abuse that is present in the federal healthcare programs, including Medicare and Medicaid. There are, of course, lots of federal dollars that are involved in these programs. And so, and they also guide the country's most vulnerable, so the elderly and those with low socioeconomic status. They are the largest Inspector General's office in the federal government. So it's important to just understand how they're looking at virtual care and telehealth in general, to see what parallels they might draw once telepharmacy becomes more prominent in the healthcare industry. So the OIG issued a statement in February 2021 as a result of the COVID-19 public health emergency. The PHE, of course, triggered heightened scrutiny because of the rapid adoption. So the OIG stated that they are conducting significant oversight work assessing telehealth services during the public health emergency. So this type of work is going to inform what telehealth flexibilities should be made permanent, but of course, evaluating if there's any fraud that's occurring because of the rapid adoption. They do distinguish between telefraud, which are sham remote visits, and telehealth fraud, which is inappropriate billing for telehealth visits. And that's really what they are focusing on. Right now, the OIG work plan includes 9 active audits and inspections around telehealth and virtual care services, which we expect will include virtual care management, e-visits, and of course, telehealth more generally. And from what we know, work products as a result of these audits and inspections are expected to be published in 2022 or 2023. They can be revised along the way, so it's not a hard deadline, but just to kind of keep in mind that these audits are going on. Okay, so here is an overview of what the work plan includes right now. You can see it's pretty general and focused on telehealth and the federal healthcare programs. There is some focus on cybersecurity, home health services, and how entities are responding to the COVID-19 pandemic. It's also important to note how the DOJ is evaluating the rapid increase in telehealth adoption. So last fall, around in September of 2021, there was a national healthcare fraud enforcement action conducted by DOJ, which involved over 1.4 billion in alleged losses. 1.1 billion was in fraud committed using telemedicine. 29 million was related to COVID-19 healthcare fraud. And then 133 million was connected to substance abuse treatment facilities, and 160 million connected to other healthcare fraud and illegal opioid distribution schemes. There are a couple other actions as well that the DOJ has taken. They've of course looked at fraudulent vaccine card schemes and then improper billing more generally. So Now it's important to kind of understand what we see the future landscape of telepharmacy to look like. We probably know with near certainty that there will continue to be an increased demand from consumers for telepharmacy. We saw during the COVID-19 public health emergency that many patients did benefit from being able to receive healthcare services virtually. That includes their prescriptions that they were able to receive at their homes. Some pharmacies did implement ways to connect with their patients virtually, so through live audio video consultations, asynchronously as well. So I think we'll definitely continue to see consumer preference for telepharmacy versus having to go into the pharmacy itself. We'll probably continue to see a focus on telepharmacy as a supplement to, not a replacement for, in-person visits. So again, if there is a new drug, for example, that the patient needs and doesn't understand, that perhaps they want to go visit their pharmacist in person for that first visit, but we will probably see that that patient would then prefer to continue talking to the pharmacist about the specific medication if they had any questions, or making sure that they're staying adherent on a virtual basis. We'll continue to see expanded use cases and perhaps eligible providers. So as we discussed during this webinar, there are many different ways that telepharmacy can be implemented into your existing model. Eligible providers, I think, will depend on whether pharmacists do end up achieving provider status under Part B. But perhaps a pathway will open up where pharmacists can receive reimbursement directly for telepharmacy services. We'll also continue to see telepharmacy as a component of health equity. There are often situations where areas of lower socioeconomic status are not easily able to go visit their pharmacy due to transportation issues, due to having to work, not being able to take the time off. So it definitely addresses that issue as well. We'll continue to see user-friendly telepharmacy platforms. There are definitely a few leaders in this space now, but there is definitely more room for additional platforms to come into play and provide really high quality platforms that pharmacies and practitioners can utilize. We'll continue to see the development of best practices, including use case specific practices. So right now, I think pharmacists are really focusing on patients who have multiple chronic conditions and how telepharmacy can help improve patient outcomes in those situations. So medication adherence, for example, is very important to patients who have chronic conditions, and we're continuing to see how pharmacists and practitioners can best serve those patients to improve their conditions. What we'll probably continue to see or not be as certain about in the future is the pace of expansion. So we saw on the map earlier that about half of the country has adopted some form of telepharmacy. However, the eastern states are a little bit slower to come on board. So we'll kind of have to see how quickly these communities also understand the value of telepharmacy. I think it'll probably speed up a little bit in the next few years than as compared to the adoption that it has occurred since telepharmacy first began. But of course, each state kind of does their own thing, so it's hard to predict how quickly they'll adopt telepharmacy. There also, one thing that we are not sure about is federal and state statutory and regulatory changes. So as I mentioned, CMS has not really looked into or if they have looked into it, they haven't issued any guidance on telepharmacy yet and what we can expect from a reimbursement perspective. Same with the states. The boards of pharmacy are the ones who are kind of overseeing the practice of telepharmacy and working on legislation or holding meetings and public comments to get more information on telepharmacy. But again, we're not sure, exactly what this will look like in the future. So as we discussed, payment parity and reimbursement, right now there isn't much of a reimbursement standard yet for direct reimbursement for telepharmacy services. We're also not sure if they do eventually start issuing coverage for these services, if they'll be at parity for the in-person version of that service. And lastly, cross-state licensure. So right now, there is the ability for physicians and nurses to pretty efficiently become licensed in multiple states. The same does not exist for pharmacists, which makes it a little bit difficult to rapidly provide telepharmacy services, because if you have one pharmacist in one location, perhaps they would like to provide services to patients in multiple states. If they're not easily able to get that cross-state licensure, it might just slow down the process. However, there are pathways for increased adoption. So there is the opportunity to meet with your state board of pharmacy officials. As I mentioned, these entities are the ones who are overseeing the practice of telepharmacy, making recommendations, issuing guidance, and kind of regulating what types of services are able to be provided that's in line with the standard of care. So definitely meeting with your state board of pharmacy can help push the adoption of telepharmacy along. Similarly, advocating to CMS or other other federal agencies who are looking at this. So recently, you may have seen that the DEA issued an opportunity for a public comment. They were looking at whether they should start to regulate the practice of telepharmacy, especially when it comes to involving controlled substances. They did have a lot of open questions in that request for public comment, where they really just wanted to understand from people who are living in this industry on a day-to-day basis what the services look like, and kind of determine what their involvement might be. So just keeping your eyes open for these opportunities to comment and meet with individuals who will have a say over where telepharmacy might go in the future. And so one more thing to keep in mind when you are considering pursuing these pathways is to keep data regarding how telepharmacy is improving patient outcomes and what the barriers might still be that are prohibiting increased adoption and utilization. So we've seen from federal agencies that they really do want to hear from the people in the field, and they like to see real life examples to help them understand exactly how telepharmacy can contribute to the overall improvement of patient care, and also what are the burdens or the barriers that are intervening with that. Okay, so lastly, I have some key takeaways from our presentation today. So telepharmacy, is it worth it? So of course, with any industry and any service, there are benefits and challenges. The benefits are definitely patient-facing. So there's ultimately increased access to pharmacy services. Offering telepharmacy instead of just in-person pharmacy care allows patients of varying geographical and socioeconomic status access these services. As we mentioned before, some patients might not have time between work and family, or don't have a way to travel to the doctor or the pharmacy, and so allowing them to receive telepharmacy services can really address this issue. There's also the potential for 24-hour pharmacy access. Although there are some chain stores who offer this currently, most of the time the pharmacy is closed after a certain time, and telepharmacy services can allow for 24-hour access. As we discussed before, there are studies that have shown there is a lower error rate through providing telepharmacy versus in-person pharmacy care. This might be because the pharmacist has more time to actually focus on the patient care aspect instead of worrying about technical issues that can be resolved electronically. There can also be effective patient counseling. So allowing the patient to be able to reach their pharmacist without having to travel to the pharmacy can definitely incentivize them to speak with their pharmacist on a more frequent basis, receive additional patient counseling services that they might not have otherwise wanted to pursue if it's not available virtually. Telepharmacy will of course continue to be advantageous as the PHE continues, especially for high-risk patients. But again, I think it'll continue even post-PHE, as patients have mentioned many times that this is definitely something that is more convenient for them and they prefer virtual care as needed. Further, from an operational standpoint, providing telepharmacy services can be more cost and time efficient. So pharmacists can focus on quality and not have to spend as much time working on technical things that can be addressed virtually. There are, of course, challenges that currently exist, both from an operational and legal standpoint, but also, as we discussed, from a reimbursement standpoint. So operationally, it's definitely important to make sure that if you are creating the software or outsourcing it to another vendor, that the technology is efficient, but also high quality, so that when it's being implemented in your customers' practices or pharmacists, it's able to be used pretty efficiently and contribute to improved patient outcomes, which is the ultimate goal of providing these services. If you're building it in-house, of course, you want to make sure you have an engineering team or somebody who is familiar with the healthcare space to ensure the appropriate functionalities are integrated. As we discussed earlier, there are significant challenges on the legal front. So there's currently no interstate pharmacist compact like there is for physicians and nurses. There may be additional licensing requirements. For example, if a telepharmacy is operating a remote dispensing site or a kiosk, some states might require that they obtain a separate license to install and operate this kiosk, and also pay a separate licensing fee. There are geographic or staff restrictions. So some states require that the telepharmacy be within a certain radius of a brick and mortar location. They also have restrictions on how many technicians one pharmacist can supervise virtually. And some states do say that the traditional in-person requirement will apply for this pharmacist to tech ratio, but and some states don't have ratio requirements at all. But again, it just depends on the state. And lastly, another challenging aspect of telepharmacy is state adoption and reimbursement. Some states, especially on the eastern side of the country, are still slow to adopt, and there's no official landscape for direct reimbursement for telepharmacy yet. All right, so that concludes our webinar on the key areas to check before adding telepharmacy to your business model. I hope you found the information useful, and I'm happy to answer any questions if there are any at the moment. Okay, I don't see any in the Q&A, but if you do end up having any questions later down the line, once you've adjusted the information or if you watch the recording back, please feel free to email me. My email is noted on the slide here. I'm also on LinkedIn, so feel free to message me there as well. And thank you very much for joining me today. I really do appreciate it.